Hey guys, this is Jeff from MEND. We'll be talking today about how to tease out mobility versus stability in the neck with your active range of motion testing. So if we have the patient extend, go into cervical extension and back down, we can think it could be a mobility issue from the spine, whether it be the thoracic spine or the cervical spine, or it could be a stability issue from the front, especially that deep front line. It has to work eccentrically as she brings her head back over her shoulders. So if the motion was painful or limited, a quick test would be just give her something to squeeze. So if we can get her to squeeze in into hip adduction, get her abdominals engaged, and do the same test, if that motion improves, where the pain goes down, we know there might be more of a stability or a motor control component, which would be a better first-line intervention versus something passive to the spine. Now the same thing can happen with cervical flexion. If we take a look at her cervical flexion, if she goes into full flexion, looking at that quantity and the quality of the motion, if the motion was limited or painful, what you can do is come behind the patient to block the shoulders, have her kind of perform a little bit of a row, and then go back into the same cervical flexion and back up. And again, if the range of motion improves or the pain goes down, we might have more of a motor control component eccentrically as she brings her chin down to her chest. If there was no change, it's probably more of that mobility component. And then one last test that we'll do from the front here, we're going to take a look at her side bending of the neck. So if we have her tip her head to the left, bringing the ear towards the shoulder, we know that there's a big eccentric demand on the right side benders of the neck. To facilitate that, we just have her do an isometric hold and then have her tip left. And looking for the same thing. If the motion improves, it's more of a motor control or stability component. If there's no change, it's probably more of that mobility component. Thank you.